Good afternoon. We are going to start our Social Services Subcommittee, and we do have a quorum, I believe. Let us take roll, Madam Clerk. I believe this means we have a quorum. We have some bills, even though I don't see any Senate patrons, but we do have some bills that we are able to conform and I think move out. So I will take up first Senate Bill 488, patroned by Senator Aird. She has requested that we conform this bill to House Bill 909 from Delegate Shin. If I can get that motion, please.
Madam Chair, I motion to conform Senator Aird's bill into, which bill was this? House Bill 909.
Okay, so that motion has been made and properly seconded. All those in favor of conforming Senate Bill 488 to House Bill 909, say aye. Aye. Any opposed? Great. Since we did have a fair hearing for House Bill 909 and it has passed the House of Delegates, I think if there are no questions from the committee.
Move to report.
Second. All right, so we have a motion to report Senate Bill 488 as substituted. It's been properly seconded. If we can open up our roll, please, Madam Clerk. Great, and that bill will report with substitute by a vote of 6-0. Okay, thank you. Our next bill is Senate Bill 676, patroned by Senator Eben. And we have a request to conform this bill to Delegate Shin's House Bill 909, which passed, and the version that passed Senate Ed and Health this morning.
Madam Chair, I move to conform this bill, Senate Bill 676, to House Bill 909.
All right, the motion to conform Senate Bill 676 to House Bill 909 as it passed the Senate committee this morning has been made and properly seconded. All those in favor of making that confirmation, please say aye. Aye. Any opposed? All right, so that bill as substituted is now properly before us. We had a fair hearing for House Bill 909. Council, would you like to update us on the changes that were made in Senate Ed and Health this morning, just so that we're all on the same page in terms of what we can potentially vote on in a few minutes?
Madam Chair, yes. So the substitute that was adopted for HB 908 this morning in Senate Ed and Health, the main change between the two is that the Senator Eben's version had a delayed enactment date, or a delayed effective date. It wasn't going to be effective it had a reenactment, so it wasn't going to be effective unless reenacted next year. And then Delegate Shin's version has a sunset date instead, so the sunset date on it is July 1st, 2025. That's the change.
Thank you so much. I do not believe we have an appropriations letter for Senate Bill 676. So. Did yours go to? So. I think that House Bill 908 did go to appropes where they, the piece around, and hold on. And then I think it passed out of appropes. Delegate Warrock?
Yeah, Madam Chairman, I'm thinking the way it came from the Senate with the reenactment, then they didn't anticipate anything needed in their budget. And since your version had basically a one-year pilot program is what it was establishing and did go to appropes, I'm wondering, I'm looking to the Uber chair down at the far end or I guess maybe, Madam Chairman, between here and full committee, if the Uber chairman determines it needs to go upstairs, he can let us know then. So, Madam Chairman, I move to report as amended, as substitute.
Second.
Delegate Warrock, I just want to clarify, did you move to report and just report? Yes, actually. Okay, great, thank you. And that's been properly seconded. So, Madam Clerk, if you can open up the rolls. With the substitute. With the substitute. Yeah. Yes, thank you for that. So the motion that's been made and substitute and we'll vote on is to report with substitute. Great, thank you. Okay, so Senate Bill 676, we recommend reporting with substitute by vote of 7-0. Great. Thank you so much. I see Senator McPike. Welcome. Committee members, before us we have Senate Bill 70.
Thank you, Madam Chair. So Senate Bill 70 would implement a policy from JLARC's study on the state's self-sufficiency programs. It requires that all local departments of social services to offer recipients of SNAP benefits services designed to improve their workplace skills and their employability. As you know, SNAP is what we used to call food stamps, and JLARC found that SNAP recipients who did not receive these types of employment and training services were less likely to be employed and had lower wages than SNAP recipients who did receive employment and training services. However, local departments of social services are not required to make these types of employment and training services available to SNAP recipients, and JLARC reported that the majority of these departments don't. In fact, only 37 of 120 actually do. And so as a result, 40% of Virginia's SNAP recipients don't have access to these services, and the bill would require all local departments to make these services available and based on funding availability, Madam Chair. And that is the bill and the recommendation of JLARC.
Great. Thank you so much, Senator McPike. Are there any questions from our committee members? All right. Are there folks here in the audience who'd like to speak in support of this bill? Is anybody here to speak in opposition to this bill? It's a very fine bill, and I think in the JLARC report to help make sure that there's accessible and affordable childcare, this was one of the recommendations. Great. The question was, does this have to go to appropriations? We do not have a letter for this in appropriations, and I saw that it flew out of the Senate appropriations, so I think probably the same way. Delegate Henson?
Move to report.
We have a motion to report, and it's been properly seconded for Senate Bill 70. Just to report, Madam Clerk. If we can open up the roll, please vote. Thank you so much, Senator McPike. We recommend reporting your bill by a vote of 7-0, and thanks for addressing our childcare needs.
Thank you, Madam Chair.
All right, Senator Favola, welcome.
Thank you. Thank you, Madam Chair. I have Senate Bill 40 before you, and it is different from Delegate Hope's Bill 75. My bill merely sets up a task force to investigate the feasibility of requiring departments of social services to set aside federal benefits that our foster youth are actually eligible for, but they don't receive when they exit the system. Some of our foster youth are eligible for, SSDI or veterans benefits, and they leave our system without any safety net. And it's just a study. The recommendations will come back to us. My bill passed the Senate 40-0. And I understand that Delegate Hope's bill was left in appropriations. Of course, that was the note I was given. So I'm hoping that, since mine is just a much more scaled back version, you would find it favorable. You would act favorably towards my bill.
Great. Thank you so much, Senator Favola. Are there questions from the committee on Senate Bill 40? All right. Are there any folks here in the audience who'd like to speak in support of this bill? I see some folks coming up behind you.
Oh.
Yeah. Good afternoon.
Madam Chair, it's John Smith with the Disability Law Center of Virginia. We thank Senator Favola for her leadership on this issue. We support the bill as written, and we hope the committee does as well.
Thank you so much. Good afternoon.
Good afternoon, Madam Chair and members of the committee. We also thank Senator Favola for this bill. Around the country, there's been a movement for states to start saving the money that comes to youth in foster care from social services for their use when they leave foster care. So thank you.
Thank you so much. Are there any folks in the room who are here to speak in opposition to Senate Bill 40? Okay. Members of the committee, we do not have a letter to report this bill either. And I know that many of us, I think, all supported Delegate Hope's approach as well. So I think hopefully we can look favorably on this.
Madam Chair, move to report.
Second. All right. This bill has been we have a motion to report that's properly been seconded on Senate Bill 40. Madam Clerk, if you can open the roll. Wonderful. Our recommendation is to report Senate Bill 40 by a vote of 7-0. Thank you so much, Senator Favola.
Thank you, Madam Chair and members of the committee.
Great. Senator Hashmi, welcome. Members of the committee, we have Senate Bill 231 before us.
Thank you, Madam Chair and members of the committee. SB 231 is quite similar to your bill, Madam Chair, HB 970. And this is the bill that we're calling Cover All Kids in Virginia. As we all know, there are thousands of children in Virginia that currently do not have any kind of health care coverage. It's about 88.5 thousand children in Virginia that don't have health care coverage. And sadly, Virginia ranks 25th in the country for the percentage of children that don't have health insurance. And we are 11th highest in the total number of uninsured children. This bill covers all children, regardless of documentation status. We have an estimated number of undocumented children with undocumented status who are uninsured at a rate of about 48%. That's compared to other children in Virginia who are covered at a rate of who have an uninsured rate of 3.8%. So this is quite a catastrophic need in our communities. We know that many states have already moved forward in providing this kind of insurance coverage. 11 states, as well as Washington, D.C., are using state funding to cover low-income children and undocumented children as well. And Utah was the most recent state. Why are they doing this? This actually saves money. It saves money for the state to provide this coverage. As we know, individuals who are not insured end up crashing into our healthcare system and using emergency Medicaid. And they are also in our hospitals that are required to provide the charity care, and hospitals are struggling because they are not compensated at the rate that they need to be in order to provide adequate coverage. Now, there's been a lot of social media coverage and critiques about this particular bill, and a lot of individuals have been commenting about the fact that why are we providing coverage for non-tax-paying individuals, and that is an erroneous argument. Our undocumented families actually contribute close to $300 million in state and local taxes, and so this coverage would be a fraction of that payment that they are already making into our system. And this, another argument that comes up is, well, why don't we allow our free and charitable clinics to cover the needs of uninsured children? And actually, our Virginia Association of Free and Charitable Clinics is a very strong proponent of this bill because they don't have capacity to provide the level of coverage that is critically needed. So, Madam Chair, the Senate has incorporated a budget amount into the second year of the biennium, and this bill passed out of the Senate Finance and Appropriations Committee as well, with good support, and we certainly hope that our House colleagues will do the same.
Thank you so much, Senator Hashmi. And I think by noting that this is in the Senate budget, I think one of our a clarifying question is that that the cost of the program is in the Senate budget, biennial budget.
It would begin in the second year of the biennium. The substitute that you received that passed out of the House, passed out of the Senate was a substitute, and it is putting this into play, becoming effective January 1 of 2026. So the second year of the biennium is the place where the funding is located.
Great, thank you so much. Are there questions from committee members? Delegate Orrock.
Madam Chair, the House counterpart of this, correct, went to appropriations. I presume this would go as well?
Yes, sir.
Okay, thank you.
Delegate Walker.
Yes, thank you, Madam Chair. Senator, you said that there was funding in the Senate budget. In the House apparently doesn't. Do you know approximately what that amount was for this?
Yes, for the second year of the biennium, it's 12, I believe it's 17,000, just over 17,000 for the second year of the biennium.
Okay, thank you very much.
Did I say 17,000? 17 million.
I was going to say, you just need
a
to add
couple
a
of
few more numbers.
zeros.
Okay.
I've had too many numbers in my head these past few
got it.
days.
Thank you.
Uber Chairman Sickles, does that answer your question?
That wasn't my question, but, we've already passed our budget, so we can send it upstairs. But our budget's already done, so this is a conference issue now.
Okay. But sometimes it's nice to live another day in the General Assembly.
Yeah.
It gives us hope. Are there any folks in the audience who are here to speak in support of Senate Bill 231? Yay.
Madam Chairman, before we hear from the United,
Oh, yes.
I
Yes.
apologize, a quick
Go ahead.
question.
Delegate Orrock.
It's primarily to the Uber chair. Well, I understood his statement. The short answer is we could not send this straight to the floor because that would then be sending the message it would have to be an item. And so for this to be embodied in the conference report, potentially it would need to go up to appropriations, correct?
Yes, sir, I think it needs to be sent to appropriation. I think probably everyone in that line knows this, and we heard them on our bill. And so, we know there's a lot of support for it, Madam Chair.
So, yes, I think many advocates came when we had our House hearing and subcommittee as well. So I'm going to ask so that everybody has a chance, because I know you've been waiting a long time today, and if you can limit your comments very brief to like 45 seconds so that we can make sure that you're on the public record. But please note that we also had a chance to hear fully from the public during the House hearing as well. All right, welcome.
Madam Chair,
yes,
if I may just make one correction to my statement. It wasn't 17,000 nor 17 million. It's actually 12.4 million that is in the Senate budget for the second year of the biennium. It's estimated that it's going to be close to 17 million as we move forward. So just wanted to apologize and make that correction.
And I really appreciate that, Senator Hoshman. Even though we're not the money people here, it's unfortunately we don't always be able to look at like the overall savings to the other expenses that might occur if we didn't pass some of the good laws that good bills that we have before us. All right, welcome. If you can keep your remarks to about 45 seconds.
Yes, ma'am. Thank you, Madam Chair and members of the committee. My name is Alexander Campbell, and I'm with David Bailey Associates. We're representing the Speech Language Hearing Association of Virginia. In order for our providers to provide adequate care, everyone in the Commonwealth of Virginia needs access to health care, and this bill does that, so we ask that you support it. Thank you.
Thank you, Alexander. Welcome. Good afternoon.
Good afternoon, Madam Chair. My name is Freddie Mejia. I am Policy Director at the Commonwealth Institute. We support this bill, and we know that for the families of 13,000 children, there really is no substitute for comprehensive health coverage. Thank you.
Thank you so much, Freddie. Welcome.
Madam Chair, my name is Lenka Mendoza for Dreamers Mothers in Action. We still support this bill. Thank you.
Thank you, Lenka. Good afternoon.
Good afternoon, Madam Chair, members of the committee. My name is Paul Berry. I'm here on behalf of the Virginia Coalition of Latino Organizations, specifically also the Hispanic Chamber of Commerce. This is a bill that we support. It's great for workforce. It's great for small business owners. We greatly hope that you will support this bill. Thank you.
Thank you so much, Paul. Good afternoon.
Hello, good afternoon, Madam Chair. Chloe Edwards with New Virginia Majority. We believe that every child should have access to comprehensive health insurance regardless of their race, ethnicity, or national origin. We ask that you all support this bill. Thank you.
Thank you, Chloe. Good afternoon.
Catherine Haynes with the Virginia Interfaith Center for Public Policy, but I want to speak a little bit as a former school board member in Chesterfield because a survey revealed, a large survey, 2,158 folks, 79% of Spanish speakers had no health care, and the number one need they reported was access to a doctor. So because I'm from a faith organization, I need to also point out that the Virginia Catholic Conference endorsed this bill. I would like you to think about the story of the Good Samaritan. But this time, it's not a man lying at the side of the road. It is a baby. I believe that it is our moral compact to cover kids. This is not a political issue. Thank you so much to both of the patrons.
Thank you so much, Catherine. Good afternoon.
Good afternoon, Madam Chair, members of the committee. Emily Moore with Voices for Virginia's Children, and we also strongly support the bill. Thanks.
Thank you, Emily. Good afternoon.
Good afternoon, Madam Chairwoman, members of the committee. My name is Monica Sarmiento. I'm the Executive Director for the Virginia Coalition for Immigrant Rights. We and our 45 member organizations fully support this bill.
Thank you, Monica. Good afternoon.
Good afternoon, Ben Barber with Virginia Health Catalyst, and for all the reasons already stated, we support the bill.
Thank you, Ben. Good afternoon.
Good afternoon, Madam Chair, members of the subcommittee. Christian Martinez, Research and Policy Analyst at CASA, and we strongly support this bill. Thank you.
Thank you, Christian. Good afternoon.
Good afternoon, Nicole Lauder at Williams-Mullen, here on behalf of the Association of Free and Charitable Clinics. And as the Senator said, yes, we fully support this bill, and we do have some capacity issues, so this bill would help alleviate those concerns. Thank you so much.
Thank you, Nicole. Good afternoon.
Good afternoon. My name is Ashley. I'm here on behalf of Homke Center, and I just wanted to share some brief words from a community member who could not be here today. My name is Sadia. I live in Loudoun County, and I'm a services provider at a community health organization largely serving people of mixed status. We provide free primary care services, and due to not having a volunteer pediatrician, we are unable to service kids. A family of 11 undocumented migrants came to us in need of essential medical assistance, and although we are able to serve the parents and grandparents, the 7 kids are still left without health care. So these are just a few of the many experiences I've encountered, and a Cover All Kids program could have been a lifeline to these children and license to a healthy, successful future. Thank you.
Thank you, Ashley. Good afternoon.
Good afternoon. I'm Victoria Richardson, healthcare attorney with Virginia Poverty Law Center, and we support this bill because all children deserve access to preventive care. Thank you.
Thank you, Victoria. Good afternoon.
Good afternoon. My name is Carla Bustillos, and I'm a resident of Franconia District in Fairfax County. I come as a mother of 3, hoping that the children of 13,000 families have the same rights as mine to health care, which is a human right. Thank you.
Thank you so much, Carla. Good afternoon.
Good afternoon, Madam Chair. Davis Gammon on behalf of the Virginia Hospital and Healthcare Association, and we strongly support the bill.
Thank you so much, Davis. Delegate Gardner, I see you have your hand up.
Yes, Madam Chair. Speaking to the bill at the appropriate time.
Delegate, you have the floor.
I move to report and refer.
Okay, thank you so much. We have a motion to report and refer this bill to appropriations. Before I do that, I just want to see if there's anybody who'd like to speak in opposition to this bill. Okay, great. Before us is a motion to report and refer Senate Bill 231 to appropriations. Madam Clerk, if you can open the roll. Thank you so much. If we can close the roll, our recommendation from the subcommittee is a vote of 5-2 to report and refer to appropriations. Thank you so much, Senator Hashmi.
Thank you, Madam Chair.
Okay, so we have 2 bills left that I think we can work on as a committee. Senate Bill 615 from Senator Pillion is similar but different to House Bill 594 from our Uber chairman. Council, Mr. Brooks, if you could please help us understand the differences between the bill we all heard and I think supported strongly House Bill 594, but it would be helpful for us to know the difference.
Yes, Madam Chair. So the primary difference between these two is that the 615 originally had language that said that upon completion of the work group, if sufficient authority and funding are provided by the General Assembly, the department shall initiate the state plan amendment process to seek federal approval for a community health worker services benefit. That language was removed, and now there is only the work group to design a community health worker services benefit for Medicaid and CHIP enrolled beneficiaries.
Thank you so much, Council. Are there any questions for Council on Senate Bill 615? Are there folks in the room who'd like to speak out in support of it? Oh, and we do have somebody online too. No, we don't want to conform. The question was, are we going to conform or not? And we didn't because I think we're trying to avoid a fiscal impact. Delegate Orrock, working hard on that. Welcome.
Good afternoon, Madam Chair. Davis Gammon, Virginia Hospital and Healthcare Association. We support the bill. Thank the patrons, both in the House and the Senate, for their work on this legislation. Staff attorney did a great job explaining the differences. We hope it'll be the will of the subcommittee to support this legislation as well. Thank you.
Great, thank you so much. And I should have said, we do have a long line, and we had wonderful testimony for the House version as well, so if we can keep our comments also to about 45 seconds so we can hear from everyone. Thank you and good afternoon.
Good afternoon. Thank you so much. Thank you to the patrons in both chambers. Ben Barber with Virginia Health Catalyst. Strongly support the bill. Thank you.
Thank you, Ben. Good afternoon.
Good afternoon, Madam Chair. Chloe Edwards, New Virginia Majority. We're strongly supportive of this bill. We are working class, people of color, in particular women, and we know that community health workers serve as the liaison between all systems and build trust. That's definitely needed. Thank you.
Thank you so much. Good afternoon.
Good afternoon, Madam Chair, members of the committee. Emily Moore with Voices for Virginia's Children, and we strongly support the bill. Thank you.
Thank you. Good afternoon.
Good afternoon. My name is Stephanie Carrington, and I'm coming here to ask you to support the bill again. Community health workers serve as a liaison between everything, and they are the key to help you guys spend less. Thank you.
Thank you for being here. Good afternoon.
Good afternoon, Catherine Haynes, Virginia Interfaith Center for Public Policy. Strongly support this bill. I referenced data from a previous survey, and the reason the survey was so impactful is that community health workers were used, and so for the first time they had meaningful data, because not everybody is going to answer a government survey if the messenger is not trusted. So I hear all the time we need to be the healthiest nation, we need good data to plan better, and that means that we need to fund community health workers so we can get better data to have a more efficient government. Thank you.
Thank you so much, Catherine. Good afternoon.
Good afternoon. My name is Jane Harris. I'm here to support the bill. Community health workers have helped me a lot in my community. I'm 67 years old. They've been helping me for the past 5 years, and I'm here to support the bill.
Ms. Jane, thank you so much for being here this afternoon.
Good afternoon. My
Good
name
afternoon.
is Anthony Jackson, and I am here in representation of the Virginia Community Health Workers Association. And also I'm tapping into my educator hat, and so health educator. So community health, you already have some facts about community health workers. I'm just gonna tap on 3. One of them is that we are outreach coordinators. We also help with navigation. We are health educators, and we are advocates, right? But we have this special touch where we are able to have the same vision, and therefore we are able to be relatable with our people in communities. And the second fact that I wanted to talk to you about has to do with the extensive documented research that talks about savings. Everything is about money, right? And so community health workers have saved 2.65 cents. It sounds like a little, but with the budget that DMAS has invested, and I did a little research, and it shows that it has spent more than $160,000 in paying for health outcome improvement, areas that community health workers have tapped in service Medicaid members, also hospital readmissions, which again, there are studies that show that we have decreased that, and wellness and health promotion. And something that I want to also elevate is that unfortunately, Virginia does not have a reimbursement yet, but there are other states, 29 states, as a matter of fact, who have embedded this same system. So the question is, what is it that is missing? Well, I think I have an idea. So that is that when Medicaid invests in their MCO, it says 2023 MCO financial report, there are those three areas that I mentioned. Community health workers can help decrease. We saw that for every dollar, $2.67. And then we could look into tapping into experience, the value-based care, and working in multidisciplinary team, meaning that we work with other providers, we work with other service components, and we provide that integrative care. So if it's your will, and I know you have it in your heart, I'm towards the heart, please consider approving and passing this bill. We just need a work group. That's it.
Thank you so much, Shantini. Really appreciate it. We have, is there anybody in the room who is here to speak in opposition to the bill? All right, we have one person online, Kimberly Dyke-Harsley.
Greetings. I come to you as a certified community health worker and a proud constituent of Delegate Walker. Hello, Delegate Walker. Back about 13 years and 9 months ago, Governor McDonnell created the Virginia Health Reform Initiative. And the advisory board that was made up of 6 task forces made recommendations. One of the recommendations was for workforce. And it listed to explore sustainable funding mechanism for community health workers. Remember, this was 13 years ago, with private insurers and DMAS. And so that would meet one of those transformational goals. And so once DMAS forms the work group, of course, that will be after you pass the bill, it's going to prove to be a worthy proactive step and result in strategic planning. Ms. Jackson already talked about the return on investment in the long-term health and wellness of Virginians. And this aligns with one of those goals that Governor McDonnell had for the Virginia's Plan for Well-Being. This is a proactive step in the form of prevention and health education. And as a taxpayer also, this increases efficient spending of our taxpayer dollars. And so in a fiscally responsible manner, I think this bill would suit taxpayers' savings and also bringing that investment back, not only financially, but into the community. Thank you for your time.
Thank you so much. And I don't know if you saw it, but Delegate Walker did wave at you. He is here. All right, members of the committee, the bill is back with us. And if we choose to report this bill, we do need to refer it to appropriations.
Madam Chair, move to report and refer to appropriations.
Second.
The bill has been properly moved and seconded to be reported and referred to appropriations. Senate Bill 615, please open the roll, Madam Clerk. All right, we can close the roll, and our recommendation is a vote of 7-0 to report and refer to appropriations. Thank you so much. And our last bill, Senator McDougall, welcome. We have before us Senate Bill 683.
Thank you, Madam Chairman. Madam Chair, was there a House companion to this? No, I know that, I was looking at some notes from many months ago, and I saw that Delegate Orrick was approached, but he might have already been too many to do.
It's all. This is the only version,
okay,
Senator.
Madam Chairman, and I know that the committee is going to have a substitute, which I appreciate you coming by and talking to me about that. And as I told you earlier, I'm very good with the substitute.
Okay.
But this is an attempt. This entity is in DSS. This process started when Danny Avula was the commissioner. Went to Commissioner Avula, talked to him about the limitations that because of the procurement rules with the state government. So you can give out these grants in smaller amounts and do them in a 4-week sort of time frame. But if you want grants that are larger, in excess of $80,000, then the state procurement rules take it to be a 6 to 12 month process. So really extend it and make it much more challenging. There's the opportunity to tap into private funds to do some of these projects. And this would enable this to move out of the department, be more standalone, and have the ability to give those grants in larger amounts and turn them around faster.
Thank you so much, Senator, and I appreciate that and appreciate your openness. I will own that. I did have some suggestions in the form of a substitute.
Move the substitute.
Second.
The substitute's been moved and seconded. All those in favor? Aye. Thank you. So, any opposed? Okay, the substitute is properly before us. I'm going to ask council to just discuss the changes in the substitute that actually don't affect the underlying bill.
Madam Chair, so there are two major changes to the bill as a result of this. The first is that previously there were 15 appointed members who were all appointed by the governor and subject to confirmation by the General Assembly. That has now changed to 6 non-legislative citizen members appointed by the governor, 5 appointed by the Speaker of the House, and 4 appointed by the Senate Committee on Rules. The second addition is that in the terms of the knowledge and experience that the non-legislative citizen members have. It adds appointment as a guardian ad litem, social work with affected youth and families, and youth policy as areas that they're looking for experience and knowledge in.
And council, thank you so much. I just wanted to confirm that it does, the way that this, the knowledge and experience section is written, it's like you don't have to have all of these things, but it's like suggested.
Madam Chair, yes, it does not require that individuals have, it doesn't require that you have someone who's been a guardian ad litem, someone who's, worked in that area, but it says that they shall have knowledge and experience. So that's not a hard requirement of certain individuals.
Great, thank you so much. And I know sometimes it's hard to find somebody with very specific experience. All right, so the substitute is before us. Committee members, does anybody have any questions for Senator McDougall? Okay. Are there folks in the room who would like to speak in support of this bill?
Yes, Madam Chair, Valerie LaRue from Virginia Poverty Law Center. We support this bill. The Family and Children's Trust is a really valuable agency within the government of Virginia. It's doing a lot of really good work, a lot of really good research, has been around for a long time and has really proven itself. Allowing it to be slightly more independent and allowing it to raise its own funds will be able make it able to expand its effectiveness. So thank you.
Great, thank you so much, Valerie. Is there anybody here who'd like to speak in opposition to this bill? All right, we do not have a letter to go to appropriations on Senate Bill 683, so.
Madam Chair, I move to report. Oh, second.
We have a motion that's been properly seconded to report Senate Bill 683. Madam Clerk, if you can open the roll. Oh, I'm sorry. We'd like to report with the substitute. Second. Okay, thank you. Senator McDougall, thank you so much for your openness. Your bill has been recommended to be reported with substitute by a vote of 7-0.
Thank you, Madam Chairman. And Madam Chairman, I appreciate the fact that as you worked through the amendments, you did couch them the way you did. As you and I talked earlier, sometimes as we're making appointments, it becomes very challenging when we have so many slotted specifics. Putting it this way helps us get the people we need and not make it so we can't find anybody to serve. So I really appreciate your willingness to do it that way. I think it's very good.
Thank you so much, sir.
Thank you, members of the committee.
All right, Social Services Subcommittee members, this is going to be our last meeting for session. So I know, it was wonderful. Thank you so much. Delegate Henson.
Madam Chair, because this is our last meeting, I just want to thank you for a job well done. I know when it comes to public comment time, I rarely hear a chair say everyone's name back to them. So I've been watching and monitoring, so I know when I do town halls, I'm going to steal that from you. So thank you so much.
Oh, thank you so much. It's very nice. All right, committee members, we are adjourned, and we'll see y'all in full committee.